Tonight in Williamson County, Fairview's Board of Commissioners considering a request to open 2 new emergency rooms in town. Right now, Fairview residents have to travel in some cases up to 45 minutes to get emergency care. TriStar, Horizon, and Ascension would like to build freestanding ERs in Fairview. The city voted to ask the State Health Facilities Commission to approve those plans. In health news tonight, a new chapter in the opioid crisis. The state health department is now encouraging people across Tennessee to keep naloxone handy to help to counteract a new drug associated with more than 30 overdose deaths in our state alone since October. This drug is a synthetic opioid called cychlorphine. And joining us now with more on this drug is Chris Thomas with the Knox County Regional Forensic Center, which has some experience with this drug. Chris, thank you for being with us.
Thank you for having me.
Let's talk about this new drug, and I hope I'm pronouncing it right, cychlorphine. Where does it come from? Is there any legitimate use for it?
Well, second question I'll answer first. No, there is no legitimate use for this drug. This is completely synthetic, clandestine lab created for the purpose of masking fentanyl, heroin, other drugs of choice. As far as its exact location, we are aware of its coming in from European countries.
It's hard to believe this thing is 10 times more potent than fentanyl, which we told everybody was 50 times stronger than heroin and morphine. That's hard to understand, really.
Right. And to be honest, when I heard those numbers myself, I'm doing the math. Until I saw a couple of the early deaths, we had individuals who were supposedly smoking fentanyl, and that was their drug of choice, and they were known to use fentanyl. However, there was no fentanyl in the toxicology at all, and the quantity in the bloodstream was 0.5 nanograms per milliliter, which is just an extremely low volume of concentration in a bloodstream. And then it proved fatal.
Well, you know, like fentanyl, people just start breathing really shallow and then they just stop breathing altogether. I had read that sometimes it takes 2 doses of naloxone to bring people around. That's scary, too.
There is scary, and some of the harm reduction specialists have issued statements stating that, you know, multiple doses of Narcan may be necessary. We always suggest talking with local EMS personnel and leadership to really gauge it. But the other really dangerous part about this drug is that it's so new. There is very little pharmacological data on this drug. So it is still in the research phase. We are working close with the Center for Forensic Science and Research and Education on trying to help toxicology companies build a profile to be able to properly test this drug, so that way law enforcement agencies and other agencies around the country will have the tools to combat this and know when they've seen it on scene.
Now, at this point, I guess we as parents need to tell our teens and anybody who listen, you just don't take anything because you don't know what it's laced with.
I've got 2 college-age children myself, and I've told them it's never been more dangerous to take street-level drugs than it is today in 2026. The recreational drug use of the 60s and 70s is gone. There is too much dangerous stuff, and it's being cut and replaced with these synthetics that are extremely fatal. And the people selling it don't know, and quite frankly, many people producing are just trying to make money and they don't care, and people are dying at a large amount, or a lot fast rate.
Well, this is an important message. Chris Thomas with the Knox County Regional Forensic Center, thank you for helping us to share that message.
Absolutely. Thanks for having me.